Ask most people what kidney trouble feels like, and they will tell you back pain or that you would surely notice something when you went to the bathroom. Almost none of that is true, and that is exactly why kidney disease is the quietest serious illness in this country. More than 1 in 7 American adults have chronic kidney disease right now, about 35.5 million people, and that number is from the CDC. Among adults over 65, it is 1 in 3, and as many as 9 out of 10 of them do not know they have it. Not because they are careless, because their kidneys never told them. Kidneys do not have pain nerves the way your back does. They lose ground quietly for years. By the time we are allowed to call it kidney failure, according to the National Kidney Foundation, 85 to 90% of the function is already gone. Your doctor is not hiding this from you either. In a 12-minute appointment, there is time to check your blood pressure and refill what needs refilling. There is no billing code for taking somebody's hand, turning it over, and studying their fingernails under a good light for 10 minutes. Almost nobody does it. But your body has been keeping a record anyway in a place you look at 40 times a day and never actually see. I'm Dr. John Myers, and I'm going to show you 9 things your fingernails do when your kidneys are in trouble. Before you click away because you assume this is about yellow nails and fungus, none of the 9 is an infection, not one. Every one of them gets written into the nail by your blood, so look at your hands while I talk. Pair of white bands that vanish when you press on the nail and come straight back when you let go. A shine on the nail that comes from something you have been doing in your sleep for months without knowing you were doing it. That is number 5, the sneakiest thing on this list, because it is the only sign here that makes your nails look better. And at the end, number 9, a nail split into 2 colors with a hard line across the middle, which turns up in up to 40% of people with chronic kidney disease and almost never in people without it. One honest thing first, because a lot of what gets said about this online is backwards. Your fingernails are not an early warning system. Some of these show up when kidney disease is already well along. The blood test is the early warning. Your nails are simply the part you can see for yourself tonight with no appointment and nobody's permission. They are the reason you finally go and get one, and that matters because kidney disease caught early is something you live alongside for the rest of a long life. Caught late is a machine 3 days a week, 4 hours at a time. Kidneys are one of the systems that change the most after 60, and they are the one people understand the least. So I took everything I tell my own patients, and I put it into one simple plan for living longer, stronger, and healthier after 60. 28 of the things that actually change as you get older. Your blood pressure, your blood sugar, your memory, your balance, and those are only some of them. Your kidneys are in there too. What is really happening inside you, and the one simple thing you do about it for every single one. Thousands of people are already using it to take back their health. Every one of them started right where you are with something on their mind that nobody ever had the time to sit down and explain. The difference is they stopped waiting to find out how it ends. It is on your screen right now, and it is dermy. Calm. All right, look at your hand. One idea first, and everything hangs off it. Your fingernail is built by living tissue out of your blood. Under the fold of skin at the base of your nail sits a patch of dividing cells called the matrix. That is the factory, fed by some of the smallest blood vessels you own. Every day it takes whatever is dissolved in your blood, the protein, the oxygen, the minerals, the waste, builds the next thin slice of nail out of it, and pushes that slice forward. A fingernail grows about 3 millimeters a month, so the nail you are looking at, cuticle to tip, is roughly 6 months of your blood chemistry laid down in order. At the fingertip, your nails are a 6-month printout of your blood, and you are holding 10 of them. Now, when kidneys fail, they change exactly 4 things in that blood. 4, keep count, because all 9 signs come out of one of these. 1, protein leaks out of you. Each kidney holds roughly 1 million tiny filters called glomeruli, the little knots of blood vessels that do the straining. Their mesh lets water and waste through while holding protein back. Damage the filters and that mesh goes sloppy. The first protein out the door is albumin, whose job is holding fluid inside your vessels. So albumin goes down the drain and the level in your blood falls. 2, your blood goes thin. Your kidneys tell your bone marrow how many red blood cells to make using a hormone called erythropoietin. Sick kidneys make less of it. Fewer red cells is anemia. And anemia means less color in the blood feeding every tissue in your hand. 3, waste builds up. Urea, creatinine, a long list of compounds we call uremic toxins. All of them were supposed to leave in your urine. Instead, they stay in circulation and irritate every surface they touch, including your skin, including the bed of your nail. 4, growth stalls. Under that kind of long, grinding strain, the body pauses the construction projects it considers optional, and there is very little it considers more optional than a fingernail. Protein down, blood thin, waste up, growth stalled. Those 4 are the pen Your nail is the paper. Let's read it. Number 1, pale nail beds. That is the anemia are second. The pink you see in a nail is not the nail. The plate is a translucent yellowish sheet, and that color is blood showing through from underneath. So, a 5-second test. Press firmly on your index fingernail with your other thumb and hold 3 seconds. The bed blanches as you squeeze the blood out. Let go and watch. In a healthy adult, the color floods back in under 2 seconds. If it comes back slowly, or the pink it comes back to is washed out, watery, almost gray, that is fewer red cells arriving. Anemia has 100 causes, and most are not your kidneys, but it is one of the most common complications of chronic kidney disease there is, and it is why so many people with early kidney trouble come in complaining about something else entirely. They are tired all the time. Stairs leave them short of breath. They feel cold when nobody else is cold, and they file all of it under getting older. It is a hemoglobin level, and that is a $2 blood test. Number 2, brittle nails, splitting, peeling, ridges running up and down. That is the protein, our first, and I am going to be honest with you right now because I would rather you trust the other 8. This is the weakest sign on the list. Brittle, ridged nails are extremely common and usually have nothing to do with your kidneys. Dish soap does it, cold weather, a low thyroid, and simply being 68 years old all do it. A study out of Brazil compared the nails of dialysis patients against healthy people the same age. 86% of the dialysis patients had at least one nail abnormality. So did 75% of the healthy ones. And the ridges running up and down were actually a little more common in the healthy group. Ridges are aging. It earns its place only because the nail plate is keratin, and keratin is protein and nothing else. When albumin is escaping into your urine day after day, the nail comes out thin and poorly bonded. Make it count. Ask whether it is new, not are my nails brittle, but are they more brittle this year than 2 years ago when I have not changed a thing? A change is a signal, a lifelong state is not. And ask whether it is stacked with anything else here, because that is the game from now on. 1 sign is noise, 2 or 3 together is a pattern. Number 3, Bow's lines. Growth stall are 4th, and this one has something built into it that I love. A Bow's line is a groove running sideways across the nail edge to edge. You can usually feel it before you see it. Run the pad of your other index finger slowly down the nail. It feels like a small step down and then back up. It means the factory stopped for days or weeks. The matrix came under so much stress that it quit laying nail down properly, so the slice built in that window came out thinner than the nail on either side. Then the crisis passed and the matrix went back to work, pushing that dent forward ever since. And a groove is not a kidney sign on its own. A bad illness will do it. A high fever, chemotherapy, uremia does it too. So the groove does not tell you what happened. It tells you that something did. And here's the part I love. You can date it. The nail grows 3 millimeters a month. 3 millimeters out from the cuticle is about a month ago. Halfway up the nail is 2 to 3 months out. Near the tip is 4 to 6 months back. So find the groove, measure it, and go look at your calendar. Either you can name the event, the flu, the surgery, the week you could not get out of bed, and the mystery is solved, or you cannot name anything at all. Body that stopped building fingernails for 2 weeks over an event. You have no memory of went through something without telling you. Number 4, Murky's lines. Back to protein. And this is where the list stops being suggestive and gets specific. They are a pair of white bands running sideways across the nail, 2 of them parallel, usually with a stripe of normal pink in between, usually on several fingers at once and classically skipping the thumb. Everybody has seen a white mark on a nail, and most are nothing. It just trapped air from a knock you have forgotten. So here is how you tell the difference, and it is the best 60-second test in this whole video. Press down on the nail and squeeze the blood out of the bed the way you did in sign 1. The white bands disappear while you are pressing and come straight back the moment you release. Those are Murky's lines. Sit with that because it is genuinely strange. A mark that vanishes when you push on it cannot be sitting in the nail. Those bands live in the nail bed, in the tissue and small vessels under the plate, and you are looking straight through the nail at them, which has a consequence you can check yourself. They do not grow out. Trim your nails, wait, come back, and the bands will be in exactly the same place. What causes them is low albumin, not a little low, very low. Robert Murky published the original series in the British Medical Journal in 1956, 32 patients with these paired bands, and 23 of them had nephrotic syndrome, which is kidney filters gone from leaky to wide open. The bands only appeared once blood albumin fell below about 2. 2 green per deciliter, normal is around 4. And look at what walks in alongside them, ankles that puff up by evening, puffiness around the eyes in the morning, one of the earliest visible signs there is, and one almost nobody connects to their kidneys, and foam in the toilet bowl that does not clear when you flush because protein in urine foams. So if you press your nail tonight and a white band disappears under your thumb, that is a phone call.